Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, DPP4 inhibitors. These DPP4 inhibitors, what does they do? They will actually degrade the incretins and they will degrade the substance P. Not these drugs, actually the DPP4 will degrade the incretins and substance P. What is this DPP4? It is actually a dipeptidyl peptidase 4, yeah, this is DPP4. So this will degrade in incretins and substance P. Now what does this DPP4 inhibitors do? So they will prevent the degradation of incretins and substance P, and thus they prolong the action of neuropeptides, like they will prolong the action of substance P. Okay, they will prolong the action of incretins obviously, and they will also prolong the action of macrophage derived chemokines. Wherever this is prolonged, this will cause these prolonging these substance P macrophage derived chemokines. These will produce inflammation, mainly because of the substance P. Substance P will result in inflammation, and these will also result in increased blood pressure. Why? Because this increased blood pressure is due to the neuropeptide Y, which is increased, which is prevented from degradation by DPP4, and it will also result in allergic reactions, and these allergic reactions are mainly due to the chemokines. Okay, so this is the main mechanism of action. Now the uses. For first pharmacokinetics, these DPP4 analogs are actually oral drugs. Among this, actually linagliptin is safe. Actually linagliptin is safe in renal failure, except that all other DPP4 inhibitors except linagliptin require dose adjustments in renal failure. They require dose adjustments in renal failure. Then what about the side effects of DPP4 analogs? The side effects are, here the patient will have side effects like nasopharyngitis. This nasopharyngitis is mainly because of the increased substance P is responsible for the this nasopharyngitis. Then it also results in upper respiratory tract infections. Cough can occur in the patient. Hepatitis is also common, especially this hepatitis is actually caused by the drug vildagliptin. Vildagliptin will result in hepatitis.
thank you and thank you for watching.